Welcome to another deep dive. Today we're exploring retinitis pigmentosa, or RP for short.
RP.
It's a condition that can lead to vision loss, and there's a lot of groundbreaking research happening, especially with stem cell therapy.
It's definitely a hot topic.
To help us unpack all of this, we consulted with Professor Dr. Suhail Sarwar.
Oh, wow. He's a leading eye surgeon in Lahore, Pakistan.
Right, and he's doing some really innovative work with stem cell therapy for RP.
I've heard his name before.
So before we get into all of that, can you give a quick overview of RP for anyone who might not be familiar with it?
Sure. So RP is, it's actually not just one disease.
Oh.
It's a whole group of inherited eye diseases.
I see.
And they all cause the cells in your retina to break down.
And the retina is?
It's the back part of your eye that senses light.
Okay, got it.
And specifically, RP affects the photoreceptors.
Those are
the cells that actually detect light.
Okay.
And when those cells break down, well, that's what leads to vision loss over time.
So it's like the very cells that allow us to see are slowly fading away.
Exactly.
That must be terrifying for those affected.
It's definitely a life-changing diagnosis.
And what causes this to happen? What triggers these cells to break down?
Well, it all comes down to our genes.
Cool.
RP is caused by mutations in genes that control the structure and function of the retina.
Mutations meaning changes in the genes.
Right, like typos in the genetic code.
I see.
And these typos can disrupt the normal processes within the photoreceptor cells, leading to their deterioration.
So it's like a faulty blueprint for those cells.
That's a great way to put it.
So we've got these photoreceptor cells in the retina. They're essential for vision because they detect light. But with RP, these cells are compromised due to genetic mutations.
Right.
What does this actually look like for someone with RP? What are the symptoms they might experience?
One of the first things people might notice is difficulty seeing in low light.
Like at night.
Exactly. It's called night blindness.
And as the condition progresses,
their peripheral vision starts to shrink, so they develop what's called tunnel vision.
Tunnel vision.
It's like looking through a tube. You can only see what's directly in front of you.
Wow. I could imagine how disorienting that must be.
It can be very challenging.
And eventually.
Even central vision can be affected, leading to severe visual impairment.
So it's a gradual but relentless loss of sight.
Unfortunately, that's the case for many people with RP.
Given this complexity,
yeah,
what are the current treatment options available for people with RP?
Well, there's no one-size-fits-all cure yet, sadly.
Right.
But there are treatments that can help manage the symptoms and slow down the progression of the disease.
Okay, so what are some of those treatments?
One approach is using medications like carbon anhydrase inhibitors or CAIs.
And those help with?
They can help manage complications like cystoid macular edema.
And that is?
It's a swelling in the retina that can further damage vision.
So it's like trying to contain the damage and preserve as much sight as possible.
Exactly. It's about slowing down the progression and maintaining whatever vision is left.
I understand there have been some exciting developments in gene therapy for RP too, right?
There have been. There's Luxturna, for example.
And that is?
It's a gene therapy approved for a specific type of RP.
Caused by?
Mutations in the RPE65 gene.
Okay.
It's a huge step forward, but unfortunately it only addresses a small subset of RP cases.
So, a ray of hope, but limited in its reach.
Now, at least.
This brings us to Professor Dr. Sarwar's work with stem cell therapy. Could you explain why this approach is so exciting and why it holds so much potential?
Well, stem cells are pretty amazing.
How so?
They have this unique ability to develop into different types of cells in the body.
Like a blank slate for cells.
Exactly. And that includes retinal cells.
So the idea is
to use stem cells to repair or replace the damaged photoreceptors in the retina.
Essentially rebuilding the eye's ability to detect light.
That's the goal.
That sounds like a revolutionary approach, almost like giving the retina a cellular reboot.
It's a very promising area of research.
But I imagine there must be some challenges in using stem cell therapy for RP, right?
Oh, there are definitely challenges. One of the biggest is the sheer genetic diversity of RP.
Meaning?
There are so many different genes involved, it's hard to find a single stem cell therapy that would work for everyone.
So it's not a one-size-fits-all solution?
Not at this point, anyway. And then there's the challenge of making sure the transplanted cells integrate properly into the retina.
And function correctly.
Yeah, and that they do so over the long term.
So it's not a simple fix, but it's a beacon of hope for the future.
Absolutely.
What did Professor Dr. Sarwar highlight about his work in this area?
Well, he emphasized that his team is really carefully studying different types of stem cells,
Okay.
and they're also looking at different transplantation methods.
So it's a very meticulous process.
It has to be. They're constantly refining their techniques to try to make the treatment as effective and safe as possible.
It's groundbreaking work, and it's incredibly exciting to see such a progress being made.
It really is.
Now, I know there's a lot of research happening beyond stem cell therapy. What other potential treatments are being investigated for RP?
Oh, there are a lot of other avenues being explored,
Like
like gene editing, using CRISPR technology, for one.
CRISPR, that's the one that's been in the news a lot.
Yeah, it's a very powerful tool.
And what about optogenetics?
That's another exciting area. Optogenetics involves using light to control cells.
And how would that apply to RP?
Well, since the photoreceptor cells are damaged in RP, the idea is to introduce light-sensitive proteins into other retinal cells.
So it's like bypassing the damaged cells and creating a new pathway for light detection.
Exactly. It's like rewiring the circuitry of the eye.
That's fascinating. And are there any other approaches being investigated?
Researchers are also looking into neuroprotective agents.
And those are?
They're essentially substances that might be able to protect the remaining retinal cells from further damage.
So it's like giving those cells extra support to help them survive.
Exactly. It's a way to potentially slow down the progression of the disease.
So it seems like scientists are attacking this problem from every angle, determined to find solutions.
They really are. There's a lot of hope for the future of RP treatment.
It's inspiring to see that level of dedication. So let's delve into some of these approaches in more detail. Can you tell us more about how gene editing with CRISPR is being explored for RP?
Sure. So CRISPR is often described as a molecular scalpel.
Because
It allows scientists to very precisely target and modify specific genes.
So in the context of RP, the idea is to use CRISPR to fix the genetic mutations that cause the disease.
Exactly. It's about correcting the errors in the genetic code.
It's like rewriting the faulty blueprint of the photoreceptor cells.
That's a great analogy. And there have already been some promising studies in animal models.
Really?
Yeah. Researchers have used CRISPR to successfully correct specific gene mutations in mice with RP.
And the results.
They've seen improvements in both retinal structure and function.
That's amazing. It sounds like CRISPR could be a game changer for certain types of RP.
It definitely has the potential.
Now, what about optogenetics? How exactly does that work?
So optogenetics is this fascinating technique that allows scientists to control the activity of cells using light.
Okay.
And in the context of RP, the idea is to introduce light-sensitive proteins into other retinal cells.
Cells that aren't normally sensitive to light.
Right. Essentially, you're transforming them into artificial photoreceptors.
So it's like bypassing the damaged photoreceptors and creating a new pathway for light detection.
Exactly. And there have been some encouraging results in animal studies.
Right.
Well, in one study, they used optogenetics to treat mice with RP.
Okay.
And the treated mice actually showed significant improvements in their ability to navigate mazes.
Really?
Yeah, and they were also better at responding to visual stimuli.
That's incredible. It suggests that optogenetics could restore some degree of vision, even when the original photoreceptors are damaged.
It's definitely a promising area of research.
Now let's move on to neuroprotective agents. How do they work, and what's their potential role in treating RP?
So neuroprotective agents are essentially substances that can protect nerve cells from damage.
And in the case of RP, the goal is to protect the remaining retinal cells.
Exactly. The idea is to shield those cells from further damage and slow down the progression of vision loss.
And are there any specific neuroprotective agents that are being investigated for RP?
There are quite a few, actually. One is called ciliary neurotrophic factor, or CNTF.
Okay.
And another one is erythropoietin, which is actually a hormone that's normally involved in red blood cell production.
Interesting. So it's like repurposing existing drugs or substances to see if they can have a protective effect on retinal cells.
Exactly. And there's also a lot of interest in antioxidants.
Antioxidants, like the ones we get from fruits and vegetables.
Similar idea. Antioxidants can help protect cells from damage caused by free radicals.
And free radicals are?
They're unstable molecules that can damage cells and contribute to aging and disease.
So it's like giving the remaining retinal cells extra support to help them survive and function for as long as possible.
That's the goal.
But I imagine there must be challenges in developing effective neuroprotective agents for RP, right?
There are. One challenge is finding the right neuroprotective agent and figuring out how to deliver it to the retina effectively.
Why is delivery a challenge?
Well, the eye has this protective barrier called the blood-retina barrier,
Okay.
and this barrier can make it difficult for some drugs to reach the retina.
So it's like trying to get a package delivered to a high-security building.
That's a good analogy. And even if a neuroprotective agent proves effective in slowing down the progression of RP, it's unlikely to restore vision that's already been lost.
So it's a valuable tool in the fight against RP, but it's not a cure-all.
That's right.
I've heard some buzz about potential oral medications for RP. Are there any promising developments in that area?
There have been some trials with oral medications, yeah.
And how are those trials going?
Some have shown more promise than others. It's still early days.
Any specific examples?
Well, there's QLT091001, a synthetic retinoid. It's shown some encouraging results in some patients.
Okay, so some potential there. What about dietary supplements? Do they have any role to play in managing RP?
Well, there's been some research into that, particularly with DHA.
DJ.
Yeah, it's an omega-3 fatty acid, the kind that's good for your brain and heart.
Right.
Some smaller studies suggested it might have some benefits, but a larger trial didn't really show much improvement for people with a specific type of RP.
I see. So the evidence for dietary supplements is still a bit mixed.
Yeah, more research is definitely needed.
I've also heard about minocycline being investigated as a potential treatment.
Oh yeah, minocycline.
It's an antibiotic, right?
Right, but it also has some anti-inflammatory properties.
But the idea is
To see if it can help reduce inflammation in the retina and slow down the progression of RP.
but its effectiveness is still being investigated.
Exactly. More research is needed to really determine if it's beneficial and safe for RP.
It sounds like there's a lot of research still to be done, but it's really encouraging to see that scientists are exploring all these different avenues.
I agree. The research is definitely moving in the right direction.
Now, we've talked a lot about mouse models and clinical trials, but has there been any research on stem cell therapy for RP in humans?
There have been some early-stage clinical trials, yes.
And what have those trials shown?
Well, one study involved injecting umbilical cord-derived mesenchymal stem cells into the vitreous humor of the eye.
And the vitreous humor is?
It's the gel-like substance that fills the inside of the eye.
Got it.
And the results.
Yes. What did the researchers find?
They found that the treatment appeared to be safe and well-tolerated, which is always a good sign.
And in terms of effectiveness?
Some patients showed signs of improvement in their vision, or at least a stabilization of their vision loss.
That's encouraging.
It is, but it's important to remember that these were early-stage trials with a limited number of patients.
So more research is needed to confirm these findings.
Exactly. It's too early to draw any definitive conclusions, but it definitely provides a reason for optimism.
It's great to see that these therapies are moving into human trials. I know electrical stimulation has also been explored as a treatment option. Can you tell us more about that?
You're talking about transcorneal electrical stimulation.
Yes, I believe that's the one. What exactly is it and how does it work?
It's also known as TES, and it involves applying a weak electrical current to the cornea,
The cornea being.
the clear outer layer of the eye.
Okay.
And the idea is that this electrical stimulation can somehow help preserve or even improve retinal function.
Has it shown any promise?
There's some evidence that TES might be able to slow down vision loss in RP, at least in some patients.
Really? How so?
Well, one study found that TES led to improvements in visual field area, the area that a person can see.
Right.
And they also saw improvements in the amplitude of electrical signals from the retina, which suggests a positive effect on retinal function.
So electrical stimulation could be another potential tool in the fight against RP. What about alternative therapies like acupuncture?
Acupuncture for RP.
I'm not sure there's much scientific evidence to support that.
So it's probably best to stick with the more established approaches for now.
I would say so, yes. There's always a lot of interest in alternative therapies, but it's important to be cautious and to rely on therapies that have been rigorously tested.
Makes sense. Now let's talk about the practical side of things. How is RP diagnosed and managed in a clinical setting?
Okay, well, when a patient comes in with potential symptoms of RP, the first step is a thorough eye exam.
What does that involve?
It includes things like visual acuity testing, visual field testing, and ophthalmoscopy.
Ophthalmoscopy.
It's a way of looking at the back of the eye, the retina, using a special instrument.
I see.
And they often use electroretinography as well.
Electroretinography. It's often shortened to ERG. It basically measures the electrical activity of the retina.
And that helps.
It can help distinguish RP from other retinal diseases that might have similar symptoms.
So it's a way to confirm the diagnosis.
Exactly.
And if the diagnosis is confirmed, what happens then? How is RP typically managed?
Well, unfortunately, as we said, there's no cure for most forms of RP.
Right.
So the focus is on trying to slow down the progression of the disease, managing the symptoms, and helping the patient maximize their remaining vision.
So what does that look like in practice?
Well, it often involves things like low vision aids, such as magnifiers and special lighting.
To help people see better.
Exactly. And there's also a lot of emphasis on counseling and support groups.
Why is that so important?
Well, RP can have a huge impact on a person's life, both physically and emotionally.
Right.
So, providing counseling and support can help people cope with the challenges of vision loss and maintain their quality of life.
It's a holistic approach, addressing not just the physical symptoms, but also the emotional and social impact.
That's right. It's about recognizing that RP affects the whole person, not just their eyes.
And what about genetic testing? Is that typically recommended for patients with RP?
It's becoming increasingly important, yes.
Why is that?
Well, identifying the specific gene mutations responsible for a patient's RP can provide a lot of valuable information.
What?
It can help confirm the diagnosis, provide more accurate information about the likely course of the disease, and even guide potential treatment options.
So it's not just about diagnosing the condition, but also about tailoring the treatment plan to the individual patient.
Exactly. And it can also be helpful for family members.
How so?
Well, if they know the specific gene mutation that's causing RP in the family, they can get tested to see if they're carriers.
And that can help them with
Family planning and making informed decisions about their own health.
So genetic testing has implications that extend beyond the individual patient.
It does. It can provide valuable information for the whole family.
I know there are various subtypes of RP, like X-linked RP, autosomal dominant RP, and autosomal recessive RP.
There are quite a few, yes.
How do these subtypes differ in terms of inheritance and how the disease progresses?
Okay, so the different subtypes are classified based on their inheritance patterns and which genes are involved.
Okay.
For example, X-linked RP is caused by mutations in genes on the X chromosome.
And that means?
Males who only have one X chromosome are more likely to be affected by this type.
And females?
Females have two X chromosomes, so they're typically carriers but don't develop the disease themselves. Unless they happen to inherit two copies of the mutated gene, which is much less common.
Okay, that makes sense. What about autosomal dominant RP?
In that case, the mutations are in genes on the non-sex chromosomes, what we call autosomes.
So both males and females are equally likely to be affected.
Exactly. And with autosomal dominant RP, you only need to inherit one copy of the mutated gene to develop the disease.
So if one parent has the condition, there's a 50% chance that their child will inherit it.
That's right.
And what about autosomal recessive RP?
With autosomal recessive RP, you need to inherit two copies of the mutated gene to develop the disease.
So both parents need to be carriers.
Exactly, even if they don't have any symptoms themselves.
So it's possible for two parents who seem perfectly healthy to have a child with RP.
That's right. If both parents are carriers, there's a 25% chance that their child will inherit two copies of the mutated gene and develop the condition.
Wow, that's a lot to consider. It sounds like understanding these inheritance patterns is really crucial for genetic counseling and family planning.
It is. It helps families make informed decisions.
Now, we've talked a lot about the genetic basis of RP, but are there any environmental factors that can contribute to the disease or influence its progression?
Well, RP is primarily a genetic condition, but there's some research that suggests environmental factors might play a role too.
Like?
Things like exposure to bright light, for example.
Really? How could that affect RP?
Well, it's not fully understood, but some studies suggest that excessive light exposure might accelerate the damage to the photoreceptor cells.
So protecting your eyes from the sun is even more important for people with RP.
It's definitely a good idea. However, it's important to emphasize that the exact role of environmental factors in RP is still being investigated.
So more research is needed.
Always.
Speaking of research, I know that imaging techniques are often used to assess retinal structure and function in RP. Can you tell us a bit about the role of imaging in RP research?
Imaging is essential in RP research. It allows us to see what's happening inside the eye at the cellular level.
So it's not just for diagnosis, but also for understanding how the disease progresses.
Exactly. And for evaluating how well treatments are working.
What are some of the imaging techniques used?
Well, we already talked about OCT, optical coherence tomography.
Right, the ultrasound for the eye.
Exactly. That's one of the most commonly used techniques. It gives us very detailed images of the different layers of the retina.
And by looking at those images,
We can see how the retina is changing over time and how the disease is progressing.
what other imaging techniques are used?
Another one is fundus autofluorescence, or FAF.
And that one is?
It detects the natural fluorescence emitted by certain molecules in the retina.
And that tells us?
It can help us identify areas of the retina where the cells are damaged or stressed.
Interesting. So it's like highlighting the problem areas.
You could say that, yes.
And are there any other imaging techniques used in RP research?
Yes, there is microperimetry.
Microperimetry.
It's a technique that measures the sensitivity of different points on the retina to light stimuli.
So it's a way to map out how well different parts of the retina are functioning.
Exactly. It's very helpful for tracking the progression of vision loss and seeing if treatments are having any effect.
It sounds like imaging techniques are playing a crucial role in advancing our understanding of RP.
They really are. They're giving us a window into the eye that we've never had before.
And that's paving the way for more effective treatments.
Hopefully. We're certainly learning more all the time.
This has been incredibly informative. Thank you so much for sharing your insights with us today.
It's been my pleasure. I'm always happy to talk about RP research.
I'm sure our listeners will find this incredibly valuable as well. It's fascinating to see how much progress is being made.
It's an exciting time to be involved in this field.
Well, we'll continue our deep dive into RP in our next episode.
Looking forward to it.
Stay tuned.
It's amazing how much we're learning about RP from animal models.
Yeah, those studies are really providing valuable insights.
For example, there was a study where they looked at proteomic changes in the retinas of mice with different types of RP.
Proteomic changes?
Yeah, it means they looked at all the proteins in the retina and how they were different in the RP mice compared to healthy mice.
So they were looking at the big picture, how the entire protein landscape of the retina is affected by RP.
Exactly, and they used different types of RP models too.
Like what?
They had models for both autosomal recessive and autosomal dominant RP. And they even included a model for another inherited retinal disease called Leber's congenital amaurosis, or LCA.
Why include LCA if the focus was on RP?
To see how the protein changes in RP compared to those in a different but related retinal disease, it helps to provide context.
Makes sense. So what did they find? Were there big differences between the RP models and the LCA model?
There were some distinct differences, yes.
Right.
But what was really interesting was that the two RP models, despite having different genetic causes, showed a lot of similarities in their proteomic profiles.
So even though the underlying genetic mutations were different, the way the disease was manifesting at the protein level was similar.
Exactly. It suggests there might be some common pathways or mechanisms involved in different types of RP.
So targeting those common pathways could potentially lead to treatments that are effective for a wider range of RP patients.
That's the hope. And this study also provided some important insights into gene editing therapies.
Oh, like what?
Well, they found that the timing of the CRISPR base editor injection was really important. When they injected it earlier in the mouse's development, specifically at postnatal day 15, they saw much better results in terms of rescuing retinal function and structure
Compared to
when they injected it later. It highlights the importance of early intervention.
So the earlier you can catch RP and start treatment, the better the chances of preserving vision.
Exactly. Early diagnosis and treatment are key.
Now, we've been talking a lot about the science and the research, but I want to shift gears a bit and talk about the human side of things.
Of course, that's ultimately what it's all about.
What is it actually like for someone living with RP?
It's important to remember that everyone's experience with RP is unique.
Right, because the severity and progression of the disease can vary so much.
Exactly. And people's individual circumstances and support systems are different too. But there are some common challenges that many people with RP face.
What are some of those challenges?
Well, imagine living in a world that's slowly getting darker.
I can only imagine how difficult that must be.
It can be very isolating. Well, simple things like going out at night or even just walking in dimly lit areas can become incredibly challenging and even dangerous.
Right, because night blindness is one of the early symptoms of RP.
Exactly. And as the peripheral vision starts to go, it's like having blinders on. You can bump into things, trip over obstacles, things like that.
It must be very disorienting,
It is. And then as the disease progresses, central vision can be affected too.
making it hard
To read, to recognize faces, to do all sorts of everyday tasks that we take for granted.
Sounds incredibly frustrating.
It can be. Many people with RP experience a lot of grief and frustration as they adjust to their changing vision. They worry about how it will affect their future, their independence, their relationships.
So it's a lot more than just a physical condition. It affects every aspect of a person's life.
Absolutely. The emotional and social impact of RP can be huge.
Are there any resources available to help people cope with these challenges?
There are some great organizations out there, like the Foundation Fighting Blindness and the National Retinitis Pigmentosa Foundation.
What do they do?
They provide a ton of information and support for people with RP and their families. They have support groups, educational resources, and they also fund research into new treatments.
It sounds like they play a really important role in connecting people and providing a sense of community.
They do. It can be really helpful for people to connect with others who understand what they're going through.
What about mental health support? Because I imagine the emotional toll of RP can be significant.
You're right. It's crucial for people with RP to have access to mental health professionals who can help them process their emotions and develop coping strategies.
Because it's not just about adjusting to the physical limitations, it's about dealing with the emotional and psychological impact as well.
Exactly. And there are also some technological advancements that can help.
Oh, like what?
There are some amazing smartphone apps now that can magnify text, provide audio descriptions of surroundings, and even help people navigate indoor spaces using beacon technology.
So technology can really help people with RP maintain their independence and quality of life.
It can. It's really empowering.
Now, I know there are many different treatment and management approaches being explored for RP. Can you give our listeners a sense of the current landscape of treatment options?
Sure. As we've discussed, there's no cure for RP yet, but there are different types of treatment options available depending on the individual's specific needs and the stage of their disease.
Okay, what are some of those options?
Well, some treatments aim to slow down the progression of the disease.
Like,
Gene therapy and gene editing are two promising areas, as we discussed earlier. And there are also neuroprotective agents, which try to protect the remaining retinal cells from damage.
right, we talked about those too.
Yeah.
And what about treatments for managing the symptoms of RP,
Low vision aids are really important for maximizing remaining vision.
like magnifiers and things like that?
Exactly. And there are medications that can help manage complications like cystoid macular edema. And of course, counseling and support groups are crucial for helping people cope with the emotional and social impact of RP.
So it's a multi-pronged approach, addressing both the physical and the emotional aspects of the disease.
Exactly. And then there are treatments that aim to actually restore vision.
Really? That sounds almost too good to be true.
It's definitely the holy grail of RP research, and it's a very challenging area, but there are some promising avenues being explored.
Like what?
Things like retinal prostheses, cell replacement therapies, optogenetic therapies, and electrical stimulation. We touched on some of those earlier.
Right. So it's like scientists are attacking the problem from every angle, trying to find ways to either prevent vision loss or restore vision that's already been lost.
That's a good way to put it. It's a really exciting time for RP research.
Now, what about alternative or complementary therapies? Are there any that have shown promise for RP?
Some people have explored things like acupuncture, dietary supplements, and herbal remedies.
And do any of those work?
The evidence is pretty limited. Some small studies have suggested possible benefits, but more research is definitely needed.
So it's important for people to be cautious and talk to their doctor before trying any alternative therapies.
Absolutely. It's always best to stick with treatments that have been scientifically proven to be safe and effective.
Now, I know all of this information can be overwhelming, especially for someone who's just been diagnosed with RP. What advice would you give to someone who's new to this journey?
First and foremost, find a good ophthalmologist who specializes in retinal diseases.
Someone who really understands RP.
Exactly. They can help you understand your diagnosis, monitor your condition, and discuss the best treatment options for now.
What other advice would you give?
Protect your eyes from the sun. That's really important. and try to maintain a healthy lifestyle in general. Eat a balanced diet, get regular exercise, things like that. And stay informed about the latest research and clinical trials. There's a lot happening in the field of RP research, and new treatments are constantly being developed.
That's encouraging. And what about emotional support? Because I know this can be a really difficult diagnosis to deal with.
Don't be afraid to reach out for help. Talk to your family and friends, find a support group, or consider talking to a therapist. There are people who understand what you're going through and can provide support and guidance.
It's so important to remember that you're not alone in this.
Exactly. There's a whole community of people out there who are facing similar challenges.
This has been incredibly helpful. Thank you so much for sharing your expertise with us.
My pleasure. I'm always happy to talk about RP and spread awareness.
And to our listeners, we'll be back in our next episode to continue our deep dive into RP, exploring the fascinating world of imaging techniques used to diagnose and monitor this condition. Stay tuned. It's amazing to think that we can actually see what's happening inside the eye at such a detailed level.
Imaging has really revolutionized how we understand and manage RP.
So it's more than just taking a picture. It's about gaining insights into the structure and function of the retina.
Exactly. It's like having a window into the eye, allowing us to see the effects of the disease and how it's progressing.
Can you tell us about some of the specific imaging techniques used in RP?
Sure. One of the most commonly used techniques is optical coherence tomography, or OCT.
OCT, we've heard that mentioned before. Can you remind us what it is?
It's often described as an ultrasound for the eye, but instead of sound waves, it uses light waves to create cross-sectional images of the retina.
So doctors can see the different layers of the retina and assess their thickness and structure.
Exactly. And this is really important in RP because one of the hallmarks of the disease is the thinning of the photoreceptor layer.
Right, because those are the cells that are being damaged and lost in RP.
Exactly. OCT can also help identify other structural abnormalities like cystoid macular edema, which is a buildup of fluid in the macula.
And the macula is?
It's the central part of the retina responsible for our sharp central vision.
So OCT provides a lot of valuable information for both diagnosis and monitoring the progression of RP.
Absolutely. It helps us track how the disease is changing over time and how the retina is responding to treatment.
Are there other imaging techniques used in RP?
Another one is fundus autofluorescence, or FAF.
FAF.
It's a way of imaging the retina that captures the natural fluorescence emitted by certain molecules.
And that tells us what?
Well, in RP, there's a buildup of a substance called lipofuscin in the damaged retinal cells.
Okay.
And lipofuscin fluoresces, meaning it emits light when it's exposed to certain wavelengths of light.
So FAF can highlight the areas of the retina where damage has occurred.
Exactly. It can show us patterns of abnormal autofluorescence that are characteristic of RP.
So FAF can help confirm the diagnosis and track the spread of the disease.
That's right. It provides a different kind of information than OCT, but it's equally valuable.
It's incredible how these imaging techniques allow us to see the retina in such detail. Are there any other techniques used in RP research?
Another one is microperimetry, which is a way of measuring the sensitivity of specific points on the retina to light stimuli.
So it's like a very precise visual field test.
Exactly. It can detect subtle changes in visual function that might not be apparent with standard visual field testing.
And why is that important?
Because it allows us to track the progression of the disease more closely and to see if treatments are having any effect on preserving or improving visual function.
It's like having a more sensitive tool for measuring how well the retina is working.
You could say that, yes.
We've talked a lot about the technology and the science, but I think it's also important to talk about the human side of RP research and treatment.
Absolutely. We can't lose sight of the fact that these advancements are ultimately about helping people.
What are some of the challenges and considerations that arise when developing and delivering treatments for RP?
Well, one important consideration is informed consent. We need to make sure that patients participating in clinical trials are fully informed about the potential risks and benefits of the treatments they're receiving.
Especially when dealing with experimental therapies, where there might be a lot of unknowns.
Exactly. It's crucial that patients understand what they're signing up for and that they're making informed decisions about their care.
And there's also the question of access to treatment.
Right. If a new therapy proves effective, we need to find ways to make it available to everyone who needs it, regardless of their financial situation or where they live.
That's a really important point. These advanced therapies can be very expensive, and not everyone has equal access to healthcare.
That's a huge challenge that we need to address.
Are there any other ethical considerations that come into play with RP research and treatment?
Well, as we develop more powerful technologies like gene editing, we need to have open and honest conversations about the ethical implications.
Yeah.
Like, where do we draw the line? How do we ensure that these technologies are used responsibly and for the benefit of all humankind?
It's a lot to consider. The scientific advancements are moving quickly, and it's important to have these ethical discussions alongside the research.
I agree. It's a complex landscape, but it's a conversation we need to have.
I know there are a lot of people listening who are directly or indirectly affected by RP, and they might be feeling overwhelmed or even scared. What message of hope would you like to leave them with?
I want to say that even though RP is a serious condition, there's so much reason for hope. The research is progressing rapidly, and new treatments are being developed all the time.
So it's not a hopeless situation.
Not at all. The future for people with RP is brighter than ever before.
What advice would you give to individuals who are newly diagnosed or concerned about their vision?
The most important thing is to find a good ophthalmologist who specializes in retinal diseases. They can provide the best guidance and care for your specific situation.
And beyond that?
Protect your eyes from the sun, maintain a healthy lifestyle, stay informed about the latest research, and don't be afraid to reach out for support. There are amazing organizations out there like the Foundation Fighting Blindness and the National Retinitis Pigmentosa Foundation that can provide valuable information and resources.
It's so important to remember that you're not alone in this journey.
Exactly. There's a whole community of people out there who are facing similar challenges and who are there to support you.
This has been an incredibly informative and inspiring conversation. Thank you so much for sharing your expertise with us.
It's been my pleasure.
And to our listeners, thank you for joining us on this deep dive into the world of retinitis pigmentosa. We hope you found it valuable and insightful. We'll be back soon with another deep dive into a fascinating topic in science and medicine. Until then, keep exploring, keep learning, and stay curious.